Everyone, I am Jada Reeves. I am one of the presenters for Archer Review, and I will be presenting to you LGBTQ care and primary care. And we will get started. We have a chat box if you would like to drop your questions or answers into the chat. We can do that, and at the end, we'll save a few minutes for Q&A. And so we will get started. Get rid of this really quick. All right. Okay, so to get started, we will talk about, let's go back to just some learning objectives. We'll identify what LGBTQIA terminology is, understand the social and medical context in which lesbian, gay, bisexual, and transgender, or LGBT, we will abbreviate it, patients seeking healthcare. We'll also describe major medical and psychological concerns with LGBT patients. And then we'll summarize strategies to promote culturally appropriate care for LGBT patients. So we started off like, well, what does it mean to have optimal care for this patient population? Well, one is important to learn the acronyms and use them correctly. As far as definitions, a lesbian will refer to a woman primarily attracted to other women. Gay refers to men primarily attracted to men. Bisexual refers to those attracted to both men and women. Transgender refers to two groups, those who identify with and transition to a gender other than the one that was assigned to them at birth. And those who express their gender differently from prevailing norms in society. Queer is more of an umbrella term, is used by some to describe people who think of their sexual orientation or gender identity as outside the societal norms. Some people view the term as more fluid and inclusive. However, due to its history as a derogatory term, it's not as embraced or used by all members of the LGBT community. In questioning, it describes an individual who is unsure about or is exploring their own sexual orientation and or their gender identity. Intersex, it is a difference in sexual development caused by hormonal irregularities during pregnancy. I will describe this term a little more in detail on another slide. Asexual is a person experiencing little to no sexual attraction to others. Androgynous is also a term that describes someone who has characteristics of both femininity and masculinity, either in their appearance or in their clothing. An ally is a person who supports another group. Doesn't necessarily mean they are in the LGBT group, but they do support them. So, for example, an ally might be a LGBTQ plus person who may fight for better work conditions. Also note that it is important that these definitions, they vary across communities and they can change over time. And not all LGBT people agree with all these definitions. So we just want to keep that in mind. And it's always important to just ask questions before just assuming. Right here is a slide, and of course, just in case you didn't know, the webinars are available for you to go back and look at on YouTube. So if you want to write down these definitions or take another look at them, so we can save time, we won't go through all of them, but just so you know, these webinars are available later. I do want to point out something that is important to know when we talk about cisgender. It's very important to know what that is because cisgender male and cisgender female are those who gender identity is assigned at their sex at birth. So I am considered a cisgender female and I identify as female. And let's say my boyfriend is a male and he was born male. He was assigned male at birth. So he's considered a cisgender male. And here are some more terminology, and we won't go through all of them, but of course, heterosexual is the sexual orientation where a man or a woman is emotionally or sexually attracted to men, and vice versa. But just go down a little bit. We have pangender, which a person who describes a gender identity that comprises of many genders. So just think of pan like all. Or pansexual is a sexual orientation that describes a person who is emotionally and sexually attracted to people, regardless of their gender. Move on to the next slide. And these terms are a little more familiar, the same sex attraction, sexual orientation. But when we talk about trans man, transgender male, that is female to male. So a transgender person whose gender identity is male, they may use these terms. So transgender male is someone who was identified or assigned female sex at birth, but they have transgender to become a male. And that's the vice versa for transgender woman or transgender female. So, what to use when we are in clinic or in office? A lot of times we use terms that we're not familiar with, and you want to get more familiar with it. So let's practice using gender neutral terms such as they, their, them, your partner. And here in the South, our youth are raised very with these good mannerisms, and they always say yes, ma'am, no, sir, and and it is very common language here, but we have to be mindful now of those who gender they may not identify as the gender or what they look like. So we want to use these gender neutral terms. Transgender man is we do female to male, transgender woman, male to female. And those are okay terms, but when we use words like transgender or transsexual or hermaphrodite, we want to just try not to be offensive, or what is your real name? If they come in and say I'm Tony, but on their record you see Tanya, and then you say, okay, well, what is your real name? So we don't want to be offensive. Another offensive term is when we use the word it, and may not talk to the person, but if you're out in the hallway or they can hear a conversation. So those are terms we just want to be familiar with. Homosexual, that is also becoming more offensive. So we want to just try to stick with gender neutral terms. And here, what we have is a gender conforming. It's basically what we consider in the 21st century as societal norms. So, for example, in 21st century, here in the USA, it might be considered gender conforming for a man to enjoy watching sports, fishing, hunting. And for a woman, it might be gender conforming if she's interested in fashion, yoga, and knitting. Another example of gender conforming is when a man cuts his hair from long to short because it's an acceptable norm. Gender nonconformity, that is when someone doesn't adhere to societal gender expectations, which includes like the roles, the way they dress, the way they behave, or in their appearance. So this is just a little graph for you to see where different terms fit in sexual orientation and gender identity and sexual development and gender expressions. So here's the clinical skills tip. When in doubt, just ask. That's the safest place to be, is to ask in opposed to assume or or make it awkward by not saying anything. So because terms they do change constantly and they carry different meanings for different people, don't be afraid to ask. You are the professional. You have the confidence, and then as your patient, you're trying to build a rapport with them. So it's not so do not be afraid to ask the patients about their identity. And when they share something with you, it's always good to say thank you for sharing that with me. You know that you identify as gender nonconforming, or please tell me more about what that means to you so I can provide the best possible care. All right, so why is this important for primary care providers? Well, the social determinants of health, that's one reason. Let me move this out the way. Sorry. Um, right now, what we deal with is economic stability. And as far as what that has to do with the social determinants of health, well, rejection of the LGBTQ youth youth and by families that contribute to high rates of homelessness, especially if their family is not in support of their choices. There are also a lack of legal protections for LGBTQ people, and housing, employment, and employment contributes to housing instability and financial instability for this population. So you do see a lot of homelessness, and when there comes homelessness, there's also risk for lack of health care, lack of screening, which leads to other healthcare complications. And then with health care, our healthcare providers, which would be you, the nurse practitioner, they lack training that contributes to the patients dropping out of care or not showing up or failing to reschedule appointments. They receive substandard care oftentimes when we don't know what to ask or don't know how to ask, or we don't probe enough and seek out things that may need screening or need further testing. And then concealing information in the healthcare settings, these are all contributors to social determinants of health. There's a widespread of experiencing discrimination in the healthcare sector, which contributes also to delayed preventative care services, resulting in poor health outcomes. And one, for example, research shows that women who are who identify as lesbian, meaning they are interested in other women, oftentimes they don't share their personal lifestyle, and sometimes they will avoid asking questions as far as STI screening, and because they don't want to identify or expose that their life choices is with other women, or they may feel they're not at higher risk because they sleep with other women. So it's always important to ask questions. Another issue that contributes to social determinants of health is social and community context, which social isolation of a stigmatized group forces social isolation and bars contributing to higher rates of alcoholism, drug abuse, smoking. Um, Another issue that is not on the slide is also increased risk for suicide or suicide attempts. The bullying of youth is perceived to be LGBTQ is widespread and common at schools and other places. It contributes to poor mental health outcomes for youth and adults, and the suicide rate is higher among this age population. Why else is this important for primary care providers? Well, LGBTQ risk of poor mental health outcomes, the status. It shows that LGBTQ individuals almost 3 times are likely to experience mental health conditions such as depression or generalized anxiety. And as a nurse practitioner, those are two things that we are able to treat that's within our scope of practice, which is depression and anxiety. Also for LGBTQ individuals between the ages of 10 and 24, the suicide is the leading cause of death. Also, among LGBT youth, they are 4 times more likely to attempt suicide, experience suicidal thoughts, or engage in self-harm. And on top of that, our young people do not disclose these feelings when they come and see you in the clinic. It has a lot to do with stigma or afraid of being exposed or coming out. So that's another reason why they internalize all these feelings and they don't talk about it. The fourth thing is between 38 to 65% of transgender. Now, remember, transgender are those who were born assigned a certain sex at birth, but then they decide that they are a different sex. So between 38 to 65% of transgender individuals, they experience suicidal ideation as well. Adolescent gay males. Is known as first of all, we have the Preventative Task Force. It is was known as the USPSTF, but they have shortened it to the Preventative Task Force. They have developed a communications tool to equip healthcare professionals with resources um, to promote more patient advocacy and to be more mindful. So I put this QR code up there. If you're able, you can scan it now. Um, and it is recommended that we screen for depression in all adolescents. However, primary care physicians should also be mindful that gay male adolescents, they have higher rates of depression than their straight counterparts, which is heterosexual, those who are men or males attracted to females. Yeah, so they have excessive rates of depression, which is related to experience of a rejection in the home and also at school. And I should also say on their jobs. Depression can cause significant morbidity in gay adolescents. So it is also important to affirm, support, and educate others. That means your coworkers, your colleagues, if you're teaching, and educate other students. If you're precepting, it is always important to educate others. Understanding sexuality, identity, um, appropriate questions to ask: do you consider yourself to be straight, gay, lesbian, or bisexual? We just ask a simple question: how do they identify? Attraction, desire, what genders are you attracted to? These are gender neutral type of questions that you can ask that are not considered to be offensive. Behavior, instead of, I used to always have a habit of asking about risky behaviors or risk-taking behaviors, and we're moving away from the word risk because it's attached to stigma, and then stigma is attached to lack of care or lack of seeking care. So the way we form this question is, what genders do you have sex with? Which, as a practitioner, it will let you know if they have some risky sexual behaviors. If they go to answering, well, I have sex with men and I have sex with women, or I have other sexual partners, and then we can identify if they have more risky sexual behaviors and know where to go with the visit as far as screening and testing. Okay, so here are a list of like care for lesbian females. That's women who have sex with women. Some research suggests that women may have increased rates of ovarian cancer and breast cancer, which may likely be due to discrimination or negative experiences within the healthcare system. Studies have also shown that lesbian women have reduced access to care and preventative services such as their mammograms or cervical cancer screenings. So we have to remember that sexual orientation is a process, and sexual identity and behaviors, they can differ. And as I mentioned before, it is so important to avoid heteronormative language. So never assume. And heteronormative language is like when you're sitting there with a female patient and you say, do you have a husband, or do you have, you have children, or you sit up with a guy, you have a girlfriend. So those are heteronormative language. Assuming that a teenage, and like say if you're seeing a young teenager in your office and you see a teenage girl and you automatically want to start talking contraceptive or birth control, when she tells you she's sexually active, and opposed to, okay, well, what gender are you attracted to, before you jump to conclusion like I need to put her on some birth control. Or instead of asking a student, a patient that may come in and you say, history, asking history about their mom and dad, because now we know these days some patients have two moms, some young people have two dads. So to this slide also, some gay males or lesbian females exhibit disproportionately higher rates of mental health and behavioral health problems that's compared to straight men, females. So it's also okay to ask about tobacco use, alcohol use, street drug use, or illicit drug use. Do a depression or anxiety screening, asking those first 3 or 4 questions. Any eating disorders, that's also very common. And just always remember to affirm this patient, support the patient, and then educate those who are around you. The care for transgender people, development of sexual orientation, it is a process. Gender is a person's sense of being male or female. And one sex, on the other hand, is assigned to a person at birth to the individual's anatomy. A person who is transgender has discordance between their gender and their sex. Not all trans people identify as lesbian and gay. The LGBTQIA community are not all in the same. So remember to treat each person or each patient as an individual, separate encounter. Care of bisexual people. So bisexual people are people who have the capacity for sexual attraction to both sexes. Regardless of their biological sex, some may prefer the terms pansexual, remember as just all, or omnisexual. Others may prefer the term fluid sexuality to describe their capacity for attraction to different genders. In spite of the words one may use to identify themselves, it is imperative to know that sexual orientation occurs on a continuum. I also listed some key indicators and practice level strategies, how to improve your work environment, or your educating your employees, and also educating yourself or recognizing your own biases. So how do you identify with your own culture, your background, beliefs, and values, and biases can definitely interfere with the way you care for people. Um, is also a good thing if you don't see it in your clinics, and you are embracing all patient populations. Is important to have certain signage or verbiage that's used, symbols that's in the clinic, patient education brochures that's all inclusive. And also just make sure you have your staff training and your in-services and updating or implementing new protocols and updating guidelines. Practice strategies is increasing staff awareness through education and staff development, improving your communication strategies, creating a safe, warm, welcoming environment. One is, I've been seeing it a lot in hospitals and clinics, that they're changing their restrooms to all gender. So they're taking down the male and female symbols and putting all gender restrooms. Also, that is considered implementing a culture of humility. So this approach urges like the learner, which is the provider or others in the clinic, to look inward take an inward look at themselves. And that's that implicit bias, which could turn also into explicit bias, where you're exemplifying your beliefs or your responses to the patient, like that you don't believe in their lifestyle. And that's what you want to be able to control or internalize and say, this is a person, this is a patient, I'm here to take care of them. So your facial expressions, your body language, your tone, and all those things should not exemplify like I'm against this, but I'm just doing my job. That's not what we do. Our job is to provide care for all individuals, and make them feel happy and supported and comfortable, because we want them to come back. Okay, knowing the difference. This is important. Transgender people are people whose gender identity is different from the gender they were thought to be at birth. So trans is often is shorthand. Sometimes people will say I'm trans. So that's another terminology. It's shorthand for transgender. And I put the two pictures there because um we're looking at this picture, it could be the same person one year and different person next year, but when we're looking at someone, we don't want to assume like um this is really a guy. If they say I'm female, identifies female, we accept that and we move on with that. Cisgender, like I explained before, it is a person who's born female and identify as female. Sexual orientation and gender identity questions. Just a couple examples of some positive labeling when you asking your patient, do you consider yourself to be straight, lesbian, gay, bisexual, or other? And if you don't know any other terminologies, you can just leave it at that or say other, and then let the patient tell you. And when you ask, what is your current gender identity? This is a type of language or terminology that should be seen on check-in when they're coming to check in, or if they're filling out paperwork. I know in my site, in my clinic, they changed all the paperwork to just make it more inclusive for all people. It wasn't just male, female. So we've changed our language as well. But it's also important to know what sex they were assigned at birth. Why? Because if you have a transgender female, which is a male patient, but he may still have all his male parts, we have to do the proper screening and examinations on these male patients. And that's the same as women. If it's a transgender male, it's a female who's now male, we still have to explain to them, they still have their breasts. We have to do your breast exam. We have to check you, for these risk factors. We still have to check you and do a GYN exam. So you just let them know that you understand how they identify, but for safety and screening and precautions and guidelines, we have to do these types of screenings. And we don't want to dismiss it because they say, well, they say they're male now. We still have to assess those female parts or those male parts according to the guidelines. Improving communication and primary care for the LGBTQ. When we are doing a review of systems, we know when the patient comes in and we're doing this intake, asking questions like, have there been any changes in your sexual behaviors since I last saw you? This is important. I've worked in school-based health clinics for a while, some years, and I had a patient from 9th grade. Her name was Chloe, who transitioned into male. So she was transgender male. By 11th grade, she wanted to identify as Clyde. And I knew this patient, so it was obvious I seen and witnessed a change. But let's say I did not know this patient as Chloe, and when they came in, maybe I seen them a year before and they seemed a little different, but I can't remember. It's important to just ask the types of questions, and it's safe to ask, has there been any changes in your sexual behaviors? Or have there been any changes in your sexual identity? Do you want to talk about your sexual health today? That's a good question to open up, to get a patient to open up and just say, well, yeah, I'm glad you asked. Having your history form should also include sexual behaviors and attractions. Always give your patient the opportunity to talk about their sex life without interrupting or without assuming. Let them tell you their sexual behaviors will tell you a lot. If they have more than one sexual partner, if they have several sexual partners, they hook up on dating apps. You can get a lot if you just let the patient tell you about it or in their sexual preferences, and then you can make sound decisions and safe decisions that where you know what to do for your patient next. Okay, what's helpful and not helpful? Understanding your own beliefs, that's helpful. Identifying what's uncomfortable for you. Now, identifying what's uncomfortable for you and then avoiding certain patients is not the way to go. So we have to face those awkward moments and those uphill battles because we want to be the best practitioner and the most accurate and most safe and reliable practitioners that we can be. So identifying your own beliefs, assessing your workplace. Sometimes you could be open-minded and transparent and ready to take on these patients, but then you notice there are barriers right there within the community in your clinic that needs to be addressed. So assessing your workplace, being that advocate for the LGBT population, um, recognizing if there's anything missing from the policy, if something should be added to the policy, what are the procedures, implementing an anti-harassment policy, or promotion of non-discriminatory discriminatory practices. I know in my hospital as an RN, one of our nurses, she transitioned from um, female to male, and and that was really hard for her transitioning as far as working in her workplace with certain people that made it difficult to where it came to a point where he eventually left because it was just not receptive and they felt that after being there for over 10 years. And so the workplace environment can be a huge barrier. Be visible, be a voice, speak up, responding to anti-LGBTQ language and behavior. So when you recognize that with your coworkers or colleagues, even people that you are close to, it's important to speak up. And make sure you know your employer, your personnel, you have all these support in place for the LGBT population because they are people, they are patients, and they will come. What's not helpful is seeing homosexuality opposite, like in the opposite sex, like in the same sex is seen as a disorder. If you got that mindset in your head, that's probably how you're going to treat your patient as if they have some type of mental health disorder. Attributing all presenting concerns to sexual orientation and gender. So we want to just make sure we're identifying how we're asking how do they identify and what is their sexual orientation. When you lack knowledge and understanding of the coming out process, it's not helpful for you when you're trying to establish care with the new patient. Using heteronormative frameworks. So it's like, well, I don't even know what heteronormative frameworks are or words are. I didn't even know if I was using it. Then that goes back to the lack of knowledge, lack of understanding. So it's important to keep yourself knowledgeable about the way you carry yourself, the questions you ask, or the way you think when it comes to LGBTQ. Also expressing demeaning beliefs about LGBTQ, and whatever that could be. I don't want to just make up things, but we hear lots of derogatory, discriminatory, or we hear lots of stigmatizing words and stereotypes, and we just don't want to internalize that and let that become part of our belief system because it will impact how we care for this patient population. So what can I do? Well, create your own plan. Think about your workplace or the classroom if you're teaching or your place where you practice. Think about your own attitudes, beliefs, and perceptions. Think about your policies and procedures. and what's going on in your work class, the agency, the culture. What is it like? What is the environment like? Think about your coworkers or even your students when you're precepting, patients. And that's another thing. You may have other patients in the same place that's looking at one of your patients in a certain way, making them feel a certain way. We have to just remember to keep in mind that we're all people, and sometimes we may have to even correct some of our patients if they are making others feel uncomfortable. Okay, so let me read this short case study to you. Let me see where we're at on time. And let's just work through it, and I will ask a few questions and you can just throw the answers in the chat. So we have Jamie, who's a Latino 14-year-old adolescent who's assigned male at birth. Jamie and his parents are Catholic and are active in their neighborhood parish, which is predominantly Latino and Spanish speaking. Jamie was born with a genetic condition that affects his kidneys, his ears, and his eyes, leading to hearing loss, eye abnormalities, and progressive kidney disease. With so many other issues, Jamie's oral health is somewhat neglected. Jamie is frequently sees a variety of specialists for his kidneys, his eyes, and his ears, but you, the nurse practitioner, are a part of his primary care team. 2 years ago, when Jamie was around 12 years old, at a routine visit, told you at a routine visit with you, Jamie's mother asked you if you could provide a referral for a therapist. She felt that Jamie started to become sadder for no apparent reason. His grades was dropping in school and started to slip. You referred Jamie to a therapist who works well with depressed adolescents, wondering if his chronic physical problems were affecting his mental health or if his medical problems have made him a target to be teased or bullied at school. So moving down, several months later, the therapist recently calls you and says says to you, Jamie's primary care provider, the therapist recently called you, Jamie's primary care provider, which is you, at the request of Jamie's parents. The therapist sounded an alarm, reporting that Jamie mentioned in a session that he thought he was having crushes on other boys and questioned the counselor whether he might be gay. The therapist commented to you, I don't really specialize in these issues. Shortly thereafter, you received a call from Jamie's school indicating that he had made a suicidal statement after an incident of being bullied. I just don't know if I want to continue living anymore. You learn that the therapist shared this with the parents that Jamie thinks he might be gay, later stating that he's okay to break confidentiality because of a safety issue was at hand. The parents repeatedly asked Jamie if he might be going through a phase. Jamie is now 16 years old. This is 4 years later, has come to your office today for a routine checkup. Your clinical assistant goes to the waiting room and looks for a teen male, but cannot identify one. After calling Jamie, an adolescent with long hair wearing makeup stands up. The assistant acts surprised and nervously states, "Oh, you weren't what I was expecting." Illicitly staring, stares from the other patients too. During your clinical visit, Jamie notes that their feelings of depression have gotten worse, as have as their symptoms of their genetic condition as well. As part of your conversation with Jamie, you ask, at this point, what gender do you identify with? And Jamie looks surprised and says, I'm not sure, but I do know I feel female and I feel best when I'm dressing this way. You ask Jamie, what pronouns would you like to use? Jamie responds, they and them works for me. Seeming relieved that you have asked these questions, Jamie tells you about the Gay Straight Alliance at school, reporting that even though this year has been difficult, they feel safe with this group. Jamie also tells you that even though their parents had initially struggled with the idea that Jamie might be gay, they now accept this. Jamie's parents have told Jamie that they love and support them no matter what. So you ask Jamie how they have been coping with having to see so many specialists, and Jamie replies, "It's hard, you know. The doctors understand my kidneys and stuff, but they don't. But I don't get treated nicely because I look different." So let's debrief. Is Jamie gay? Is Jamie transgender? And how could you figure this out? You can just drop an answer in the chat. I'm not able to see the chat. Let me see. Sam, do you see anything in the chat? And also, the next question is, how do Jamie's social identities affect their health and the care they receive? What key concerns do you have now that Jamie's health and health care? And from both a clinical and non-clinical perspective, what strategies would you recommend to meet the needs of this patient? Those are the things I would want to think about. I would not assume that Jamie was gay. Uh, but in my mind, I would believe that Jamie was transgender, transitioning from male to female, and the best way to know is to ask, and which is what I would do. Um, as far as Jamie's social identities affecting their health, well, this person was born with multiple comorbidities due to a defect at birth, which they have to see a kidney specialist, eye specialist, ear specialist, and if those specialty doctors are not um, educated or knowledgeable or have even recognize their own biases, this will affect Jamie's health drastically because just from the presentation, we learned that they will stop going to see their doctors. They will avoid care if they feel uncomfortable or feel judged or um, feel like people are just going to stare at them and make negative thoughts or think negative comments about them. So that would be my main concern, and maybe reach out to Jamie's specialist to have a small conversation as far as their decision on their um, sexual identity. And that would be also the concern with that my concern would be Jamie would stop going to seek care from these doctors that has been following Jamie all of their life and know them well, and that will be a major concern. Um, And if you have any other ideas or thoughts or strategies that you would recommend, what would those strategies be? And if I can't see your comments, but those are things you want to think about, this is a real case scenario. It's not made up. And so it would be something that you may face someday in clinic, and how would you deal with it? Because this is the day and time we're in, and we don't want to just push patients aside, and we want to make sure they're getting the care that they needed. Do we have any questions or any in the Q&A? This also is an older slide that we need to change for our 3-day live review. The next one is coming up in September. But I do want to refer you to the Archer Review website, nurses.archerreview.com/FNP. We are on just about every social media platform. And we welcome any types of questions, or if you seeking for certain information regarding what we offer in our question bank, on demand. We also have a Sure Pass now, where it includes all of our services. Um, and we also have tutoring. You can feel free to email us at any time at nurse practitioner. Email us at nursepractitioner@archerreview.com. Let me see if we have anything in the chat. Yes, our 3-day live, the next 3-day live is November 15th through the 17th. And thank you for putting that in there. And then the links are also in there for you to click on if you need to know or want to know more additional information that is available. But if we don't have any questions, I don't see anything in the Q&A. That will be it for today, but we welcome you to join our community. Archer Review is here for you. We have that one-on-one tutoring that you may find helpful. And we also have a very good support group on Facebook. You can go in there and you drop questions in there, and it's always someone that can answer one of your questions, or you can try to email us, or just log on to the website and check out all the services that Archer Review offers. And Monday, we are giving away a free Sure Pass, a combo package. So look out for that. Be sure to attend the webinar. And we thank you for your time, and we will call this a wrap.